Michael, I have been interviewing representatives from Oxfam, yourself included, every January for several years now about your report on inequality published annually at the World Economic Forum in Davos. Could you start off by telling me how you and Oxfam have found the last year with COVID-19 on your work with the people you help in developing countries, and then give me an overview of what is in your latest report?
Sure. Well, I think everybody in the world has been struggling, whether they're poor or not, because of the COVID crisis. You know, everybody is facing lockdowns. People are losing their jobs. People are getting sick. It's a time of uncertainty. But unfortunately, it's impacting people who are in least developed countries more, and we see it exacerbating and underlying existing inequalities. So, for example, while Ireland is having challenges with our health system, we have a first world, pretty well functioning health system. We have a vaccine rollout. A lot of countries in the world don't have a functioning health system, and once COVID hit, it caused a lot of challenges for people, both in terms of COVID, but in terms of the lockdowns that were implemented. It has a lot of people work in the informal sector in low-income countries, and they have no state supports like we have here. So one of the people we worked with said the virus will starve from the virus before we get the virus. It's upset harvesting, it's upset food supplies. People who are employed in global food or in global supply chains are affected. For example, in Bangladesh, tens of thousands of workers in the garment industry were laid off or forced to resign from global buyers after consumption levels were reduced here. It's also been very difficult for our colleagues in low-income countries to actually go out and do their existing work that is going on and that needs to keep going. And people are finding it really hard just to get by. To give you an example, just a very simple thing like being able to self-isolate is really a privilege of space. And while hopefully most of us will have our own bedroom or will be able to access an old bedroom if we want to self-isolate, that isn't always the case. If you're in a refugee camp, if you're in overcrowded accommodation, being able to self-isolate is not always possible, and that can be challenging. However, having said that, some countries like Sri Lanka, like Vietnam, have done a way better job than us in terms of dealing with this. And some countries in Africa who have experience of similar pandemics, whether it's Ebola, etc., have put in a lot of systems that we're only getting up and running here. So while it's been hugely difficult for a lot of poor countries, we shouldn't look at it as a place where there's just bad things happening. They have been doing some things right that we haven't been doing here. And sorry, your second question was about the report.
Yeah.
Yeah, so as you said, every year round now, to correspond with the World Economic Forum in Davos, where most of the richest people and the top policymakers in the world gather to look at threats and possibilities for the global economy, Oxfam produces what we call a global inequality report to highlight, despite promises, despite commitments, levels of inequality are still rising, they're still extreme, they're still having a huge impact on people's ability to rise out of poverty. And this year is no different, and it's almost more stark this year because what we found is that the world's billionaires, their wealth has increased at an astronomical level. And if you compare that with the amount of people who've been driven into poverty because of the pandemic and the lockdowns, it's even more extreme than usual years. So what we found is the 1,000 richest people on the planet, they recouped any losses that they made since the pandemic happened in just 9 months, whereas estimations by major international bodies have said it'll take a decade for the world's poorest to recover from the economic impacts of the pandemic. And likewise, we've seen in Ireland, Ireland's 9 billionaires saw their fortunes increase by 3.28 billion. To put that in context, that's about a tenth of what it would cost for us to be able to buy enough vaccine to vaccinate every person in the Republic. But while the billionaires' wealth has been increased, our society and our economy has been kept going by essential workers such as carers, supermarket, retail staff, factory workers, who are often on low wages. And a lot of hundreds of thousands of Irish people are getting by on reduced incomes. They've been made temporarily unemployed by the pandemic. So it just re-emphasizes that the pandemic is no different from other times, except it's more extreme. If you have power and you have ability to generate wealth, and if you've less power, your ability to generate income and to be negatively affected by the pandemic is increased.
Okay, and how is the World Economic Forum meeting this January, Michael, in light of COVID, like the restrictions, like?
A bit like everybody else, it's not meeting in person. It's doing it digitally, and I guess like everybody else, they're hopeful and ambitious that the pandemic will be over by the summer, and they're hoping to have an in-person meeting then in the summer.
Okay, I have a couple of follow-up questions for
Sure.
you, but just one question, the main question first of all, in light of your report published with Davos, what are you and Oxfam calling for?
What we're calling for is basically that the fight against inequality must be at the heart of any economic rescue and recovery efforts. Governments must ensure that everybody has access to the Covid-19 vaccine and financial support if they lose their job. And as I mentioned, this isn't the reality around the world. We have estimated that the top multinational corporations have been able to generate a huge amount of extra profit, and if that was taxed via a once-off excess profit tax, it would be enough money globally to ensure that everybody had proper social supports to get them through the pandemic. We're also asking, in terms of the vaccine rollout, it's probably a big thing that listeners have been listening to, and the challenges here. There's also massive challenges and even bigger challenges in low-income countries. They're back at the line. Very few of the poor people in the world will get any vaccines this year, and it's estimated that it'll be next year or the year after before vaccines, before everybody in the world is vaccinated. That obviously has huge problems in terms of equity, but also in terms of our own self-interest. Everybody isn't safe from this pandemic unless everybody's safe. So what we're calling on governments is to ensure that pharmaceutical companies share the IP and the intellectual property related to their vaccine development, because remember, a lot of these vaccines have been developed with public support, and this would ensure that there's more manufacturing capacity from generic companies in middle-income countries and low-income countries that would increase the supply of vaccines and ensure that everybody could be vaccinated quickly. We also want governments to ensure that they must invest in public services and low carbon sectors to create millions of new jobs and ensure everybody has access to decent education, health and social care. And they must ensure that the rich as individuals and corporations contribute their fair share of tax to pay for it. These measures must not be a band-aid solution for desperate times, but a new normal. And we should be creating, a lot of people have talked about, oh, we need to change things and this is a wake-up call, but that fine rhetoric has to be turned into reality.
That's a big campaign, isn't it, for a people's vaccine that Oxfam are involved in, aren't you?
Yeah, no, it's a global campaign, and while countries like Ireland have made some good efforts in terms of the COVAX process, so that's buying up some of the vaccines and ensuring some supply reaches low-income countries at reduced prices. It's nowhere near enough to ensure that everybody in poor countries, especially frontline workers, vulnerable populations, older populations, will have a situation where, you know, people who are least vulnerable in Ireland and in the EU will be getting vaccines before frontline health workers, and vulnerable people in poorer countries will be getting the vaccination. So we're really pushing that governments do a lot more, and especially that they look at ensuring that the technologies, the health technologies around developing these vaccines are shared widely, that it's a public good. This is a health emergency. These should be a public good. And that we have spare manufacturing capacity globally, and we should be using all manufacturing capacity.
Okay, do you know, Michael, if there's been any progress on the international standardization of corporation tax regimes?
Yes and no is the answer. So the OECD has been working on this for a number of years. And while there has been some progress, we've moved on to talking about what's called a minimum effective tax rate, which is something that wouldn't have been talked about years ago. So that's a huge big deal. And we're also looking at how to adequately tax the digital sector. Again, that's huge progress. Unfortunately, the Trump administration really slowed up this process, a bit like a lot of other multilateral processes. But the Biden administration has signaled that it will be starting to negotiate again as part of this process, and hopefully we'll see some clear proposals probably by the summer of this year. The EU has indicated that if the OECD process isn't able to come up with a solution, that it will move forward with its own proposals to deal with this area. So I would be hopeful, although there's a long way to go yet, that we would get some clarity and some good reforms in relation to this by the end of the year.
You mentioned the Joe Biden administration. That was my next question to you. From your point of view in Oxfam, do you welcome Joe Biden becoming the new president of the United States in terms of your work going forward over the next 4 years?
Well, Oxfam has welcomed the fact that the democratic process was maintained in the US, and we issued a lot of concern in relation to what happened in terms of trying to overturn the legitimate election. So it's a positive thing that democracy has prevailed. In terms of the Biden administration being elected, I think it's potentially positive on a number of levels. And again, it all depends on whether the Biden administration is able to follow through in its commitments. He's moved very quickly in terms of climate change to renormalize America's relationship with the Paris Agreement. He's proposed a new leaders summit this April, and he's trying to pull together all the pieces that America catches up with a lot of the rest of the world with this. And that's quite positive in terms of the big COP meeting that's going to happen at the end of the year in Glasgow. In terms of other areas, he's signaled positive things in terms of Trump's regressive immigration policy, in terms of its targeting of Muslims. But I think it's early days in relation to a lot of other areas that Oxfam would be interested in. I think he's a key player in terms of the vaccine campaign, in terms of his administration's power and influence over American vaccine companies. But it's quite positive, at least, that we have an administration that is starting to make decisions based on science and based on facts. I think a lot of people are surprised that they would ever say that, would have to say that as being a thing that is good. But I guess we have to recognise that as a good thing.
Okay, to come towards the end of the interview, Michael, is there anything else on the national and global picture that you would like to tell our listeners about looking forward over the next year and few years with the impact of COVID on your work?
Well, I think the message that we tried to get is that the processes that are generating these high levels of inequality express themselves in different ways in different countries depending on the systems there, but they're essentially the same processes, and Ireland is no different. We've seen situations around the world where people are skipping queues to try and get vaccines, or the rich are flying out to get vaccines in Dubai on their private jets. The level of private jets purchases and use has increased so people can avoid lockdowns. I think in Ireland, what we're hoping for is that the solidarity that has been generated with this, and also people's recognition of the huge investment that is needed in our public services to help us survive this, that we don't turn our back on that after the pandemic, and we don't go back to austerity, that we recognise the investment needs, and that we have a proper discussion about how these should be paid for to ensure everybody has equal and speedy access to proper public services.